This is the most serious public health crisis that this country's ever seen since the creation of the NHS. And it's coming at a moment when the NHS is at its weakest. We're 10 years into a campaign to defund and to degrade the NHS and the attacks on staff and also the attacks through privatisation. If you talk to staff at the moment, there are a couple of things that are really on our minds. The first one is the staff shortages. There are 100,000 NHS vacancies at the moment. The other issue is access to the personal protective equipment. Even staff who've been exposed, they're saying that they are having to ration the number of masks that they're using and that they're no longer able to use the full gear, the gloves and the aprons, and they're just using the basic surgical mask as protection, which is just completely inadequate. The other thing that's a real concern at the moment is the access to testing. Mass testing is what we should be doing. We should be doing that for everybody. But at the bare minimum, we need to be ensuring that NHS staff are having access to the tests so that we're not unknowingly spreading it to at-risk patient groups, and also making sure that we're not self-isolating at home with symptoms when we don't need to be. I've got colleagues where I work who are absolutely desperate to get back on the wards, but they're being told to stay at home and they're having to isolate because of symptoms, but there's no confirmation that it's down to COVID-19. It's not in the public interest that access to the test is only limited to those people who have £375 to spare to be able to access the kit. Those who are in control at the moment cannot be trusted to safeguard us. It's taken collective pressure in order for us to be able to shut the schools, for example, and to get the isolation measures put in place. So we need them to act now, and the only way that we can do that is for all of us to keep applying pressure collectively and to be making these demands. So the COVID-19 virus differs from the flu in a number of ways. COVID-19 is a lot more contagious than the common flu. It's about 2.5 times more transmissible. The mortality rate is significantly higher with COVID-19 than common flu. The mechanisms by which that happens is by causing a chest infection, by causing pneumonia, which causes in turn respiratory failure, which means that your lungs have essentially shut down and you're not able to breathe independently, hence the need for mechanical ventilation. That's a tube down your trachea and into your lungs to help you breathe. I think it's a serious error to think that this just affects older people. We've seen from the data coming in across Europe that patients that are needing to be hospitalised, that group is not limited to older patients or even the immunocompromised. It's really important that we don't become complacent. What this crisis has shown us has been who the most important, most valuable public servants are, who those key workers are. It's not right that when we come out of this, NHS students are starting their careers as nurses or doctors heavily in debt. Nurses and those who are putting their lives at risk, actually, it's not right that they are left having to rely on food banks. We shouldn't need to wait for there to be a crisis such as this in order for us to be sounding the alarm about the impact of austerity on the NHS. We don't have to operate purely as individualists and an atomised society. We can support each other and great things can come of that. The health and the welfare of our most disadvantaged is the health and welfare of all of us. It's important that we not only just stop thinking about ourselves as purely individuals, but also thinking about us as an entire human species beyond just the borders of this country or beyond the borders of Europe. Understand that we are all very, very closely interlinked and we rely heavily on each other. Information and knowledge is our power, and now more than ever it's absolutely crucial that we have good independent media. So please support Double Down News on Patreon, become a supporter and share their videos. Join the future of journalism and join Double Down News.